Hello, Dr. Burns. How are you today?
Very well, Nurse Jackie. Today, we are here to discuss multiple organ failure, a very important subject in the medical field.
Multiple organ failure after trauma is still a leading cause of post-injury death. Now, it has been proven that excessive systemic inflammation following trauma participates in the development of multiple organ failure. This means that severe inflammation, infection, or sepsis of the body and its organs leads to organ dysfunction. Severe trauma with muscle and tissue damage can also cause this condition.
It has also been shown that patients who receive 6 or more units of blood represent a high-risk group for the development of multiple organ failure. Studies also indicate that multiple organ failure after trauma is established within 24 hours of injury in the majority of patients who develop it. It appears that multiple organ failure is already present at the time when medical staff are trying to predict whether or not it will occur.
Well, Dr. Burns, what are the symptoms of multiple organ dysfunction after a severe trauma?
TTHE symptoms depend on which organ system is failing. For example, if the kidney fails, the patient will have fluid retention and blood pressure fluctuations, and if the liver fails, you can add jaundice, acids, and itching to that list.
If the respiratory system fails, the patient will have poorly oxygenated blood and the heart muscle will not function well.
Without adequate oxygenation, the liver and kidneys do not function well either, but are not as sensitive to low oxygen as the heart. When the heart begins to fail, it cannot properly pump the blood through the body, and the backup of blood causes fluid to leak into the tissues, resulting in pulmonary edema. The lungs fill with fluid, further restricting oxygenated blood to the body. The end result is a vicious cycle that ends in cardiopulmonary collapse.
So, Dr. Burns, what is the medical management for multiple organ dysfunction?
Well, Nurse Jackie, I am glad you asked. At the present time, there is no drug that can reverse multiple organ dysfunction. Therapy is limited to supportive care, maintaining adequate vital signs, especially tissue oxygenation. Mortality varies from 30% to 100%, where the chance of survival is diminished as the number of organs involved increases. The mortality rate has not changed since the 1980s.
Oh, Dr. Burns, what can we as nurses do to promote home and community-based care for these patients? And what about long-term care?
The challenge to these patients is to support physiologic function while minimizing new organ dysfunction. In the recent study, multiple organ failure occurred in 47% of trauma patients and was significantly associated with long-term survival and functional status. Out of 322 patients, 75% were still alive at a 2-year follow-up after discharge from the ICU.
Yes. That is such great news, Dr. Burns. Do these patients go home with home health care or just supportive care? And when do we know when to discharge life support?
Very good questions, Nurse Jackie. I see you have been doing your research on multiple organ dysfunction. It's always wonderful to see nurses keep learning even after they get their degrees from Greenville Tech. Well, severe head injury has been reported to be the leading cause of both early and late deaths after trauma. There is also a strong relationship between the degree of organ failure immediately after injury and the patient's functional status at discharge. These patients were 4 times more likely to require assistance in activities of daily living more than 2 years after trauma compared to trauma patients without organ failure.
And there was no significant difference regarding self-care among patients with no organ failure versus single organ failure. More than 2 years after severe trauma, only half of the ICU survivors had fully recovered with the resumption of a normal life.
Excuse me. However, most of these patients were able to look after themselves without outside resources. Discharge of life support must be a well-thought-out decision that is based on many things: patient status, chance of survival, and patient's wishes to be considered. That is never an easy choice, but one that sometimes has to be made in the best interest of the patient.
That is so wonderful to hear. Not the life support part, but the part about the patients going home with little to no help.
Kind of makes me happy too, Nurse Jackie.
Thank you for clarifying multiple organ dysfunction syndrome with me today, Dr. Burns. It is something I will take back to the floor and tell the other Greenville Tech nurses about. I think Nurse Sheely and Nurse Mims will really enjoy it.
Back to the ER trauma bay for me, and you need to get back to the floor.
Multiple organ dysfunction syndrome was brought to you by Sandy Pink, Natasha Freeman, Lori Baker, Jesse Rondolp, Reggie Shields, Sherry Tucker and Sonia Benson.